Hi, I'm Brett Weinstein. I'm an evolutionary biologist. My specialty is evolutionary trade-offs. I've studied the relationship between cancer and senescence. I've studied the evolution of human morality. I've studied the relationship between species diversity and latitude. And I also, in my dissertation work, studied neotropical bats, which are obviously relevant to COVID in a sense. It may not be obvious to people why you would have an evolutionary biologist on a panel like this. I'm obviously not an epidemiologist, I'm not a vaccinologist, I'm not a doctor, but evolutionary biology is the linking thread that connects all of the various fields involved in understanding the COVID pandemic, and so it's the right toolkit for wrestling the big picture into clarity. And I must tell you that big picture is extremely disturbing. In fact, I don't think it's an exaggeration to say that all told, the decision-making surrounding COVID amounts to the largest blunder in human history. From the fateful decision to search out the ancestor of SARS-CoV-2 in the wild, bring it into the lab, enhance its capacity to infect humans, to our inept and narrow response once that virus had escaped into the wild, we have what is, in effect, an ongoing self-inflicted wound. Worse still, the poor decision-making at the very beginning of COVID, not acknowledging that the virus was circulating and not treating it with the best tools at our disposal, left us in a situation where we effectively ran out the clock on the very brief period of time in which we might have driven the virus to extinction. So at this point, we have millions needlessly dead. We have trillions of dollars of wealth that have been destroyed, and the vital systems that humanity depends on have been stressed to their very limit. But worse than that, we have now made this virus into a permanent fellow traveler of humanity. And what that means is that as staggering as the costs that we've already paid have been, the costs yet to come will certainly dwarf them.
Thank you.
I agree with Dr. Weinstein that our approach to this pandemic is the biggest public health mistakes in history, the biggest public health fiasco in history. We basically disregarded basic principles of public health. And in 2020, together with Jay Bhattacharya and Dr. Sunata Gupta at Oxford, I authored the Great Barrington Declaration, where we argued for a different approach with better focused protection on older, high-risk people while keeping schools open and not locking down the rest of society.
It turns out with both Pfizer and Moderna, we had a 1 in 800 risk of serious adverse events. These are from that list. So now, to understand what a 1 in 800 means, consider that our other vaccines have about a 1 in a million. 1 in a million, maybe 2 in a million. This is not the same sort of safe. This is 1 in 800 is disastrous if true. Is the benefit outweigh these harms in this environment? Nobody has any idea. There's no way to know that because you need a study to figure that out. It's the only way, but we just keep recommending safe and effective. Doesn't change. It's not even a scientific wording, safe. It's not safe and effective. It's more of a campaign, like a campaign slogan, or not even. It's a advertisement.
And that 1 in 800 number, that's for short-term risks. That's
Yes.
before we get to the things we don't yet know about, the things that might occur 2 years down the road, autoimmune disorders, cancers, and the like. So that's a conservative number.
It's within the first 2 months.
The message that was given to us by public health authorities was not just inept. It actually went well beyond that. It was really the inverse of everything we should have done. And because it was forced on us with this strong form of coercion, it was widely accepted because people didn't have a choice. But what we don't often talk about, we do talk now about the adverse events, for example, of these so-called vaccines, but what we don't talk about is the question of what would have happened if we had taken a different path. And these vaccines, which I regard actually as a technological achievement, they're a prototype that should never have been injected into people, in my opinion, but nonetheless, they are impressive and they have potential. But by utilizing them in the way we did, we effectively turned the world into a gain-of-function experiment. We gave this virus a evolutionary puzzle that was very easy for it to solve. Because the vaccines were so narrowly targeted, we effectively drove this pathogen to diversify. And there's a question about how many variants we would have faced if we had not done this and had instead used repurposed drugs, for example, to treat patients who needed it. And we will probably never know, but it is not clear that the harm is limited to the people who were injured. The harm may be that the pandemic continues because of this policy.